Everyone. Hope everyone is doing well. Just up front, we're going to be talking about medical facilities. This does not include nursing homes. That's an entirely different subject and probably a topic for another webinar at a future date. So we'll just be talking about medical facilities like medical office buildings, hospitals, that type of thing, and not nursing homes. So with that, there are several different areas that we're going to cover today or talk about. The first is we'll talk about assessment practices. Then we'll dive into exemption issues. Certainly we get a lot of questions about does this physician's office qualify or this hospital? So we'll address exemption issues. We'll also talk about Indiana Board of Tax Review and Indiana tax court cases. And then, as Jenny alluded to, if you have questions, please let us know and we'll try and address those as best as we can. So having said that, as far as assessment practices go, there is nothing statutorily that requires one of the three values to be used, say like with golf courses or self-storage facilities where you have to use the income approach in order to approximate or get close to the market value and use. You can use one of the three or all three approaches to value: the cost approach, the sales approach, and the income approach. So I'll start with the cost approach. And in our guidelines, we have pricing for medical clinics and hospitals. And you can see there the link to our website for Appendix G, where we have our cost schedules. And medical facilities are either going to be assessed using the general commercial residential, the GCR schedule, or it's going to be assessed using the general commercial mercantile, the GCM schedule. So medical clinics, for example, if it's a full line medical clinic, it would be assessed like a hospital. If it's limited service, depending on the materials used, it may be assessed either under the GCR medical office or GCM medical office. If it's a special purpose medical clinic, again, much like with the limited service, depending on the materials used, you would use either the GCR medical office schedule or the GCM medical office schedule for pricing to obtain the replacement cost new less depreciation. For multi-purpose facilities, it follows the same thing in terms of the materials used, and typically what we see is with multi-story buildings or facilities, they will be under the GCM general office schedule. As far as hospitals go, if it's a convalescent hospital, again, much like with the other facilities, depending on the materials, you're going to be either using the GCR general office schedule or the GCM general office schedule. If it's a full line hospital, again, one story wood joist framing is going to be general GCR general hospital or GCN general office pricing, and then for multi-story, you'll use the GCM general office. And this is straight from our pricing schedule. You can see the base prices depending on the medical office for GCM. And then for GCR, you can see the pricing is a little bit different, obviously depending on the number of stories and whatnot. We also have some base price components and adjustments, for example, for heating, air conditioning, adjusting for lights, the interior finish, all those that go into compiling the base cost of the facility or the property. As far as the GCR schedule, you can see this is how it prices out. In regard to the income approach, you would treat a medical facility much like you would any other income producing property in terms of looking at the income and expense, and then also looking to make sure you have all your ducks in a row, so to speak, but also making sure that you're looking at the drawing a blank on the your I'll skip that. Okay. Anyway, income approach, do it much like you do with any other properties. And then as far as the sales approach, certainly you want to look and make sure that the sales approach, you're using comparable properties. Is it a medical office building or is it a general office building? Is it a hospital? Similar, where is that hospital or property located? Is it in close proximity? Is it near, far? So much like what we do with all the other properties in the sales and income portion, we do the same way with medical facilities. In regard to exemption issues, we receive a lot of questions. What happens if this medical facility, say an office building that's located next to a hospital? What if it's just occupied by the doctors that may or may not be practicing over at the adjoining hospital? Does that get exempt? And exemption issues are dealt with on a case-by-case basis. So much like what you do with other exempt properties, you'd have to see, does that exemption application fit into whatever category or applicable code citation that the taxpayer is petitioning under. Indiana Code 6-1.1-1016 is one of the main exemption articles or code citations used in regard to the educational, literary, scientific, religious, or charitable purposes. And we'll scroll through and get to the main meat of the subject as far as hospitals and medical facilities go. But you may have medical facilities, be it a hospital, or a medical practice, whatever the case may be, claiming that they are exempt, say, under the religious or charitable purposes. Here in central Indiana, Indianapolis, for example, Ascension Health is a big healthcare provider, or Community Hospital Networks is another big one, or St. Francis, Hendricks Regional. So there are a variety of healthcare providers, and if they do apply for an exemption, the PTABOA, the Property Tax Assessment Board of Appeals, would be responsible for making sure that the taxpayer met that criteria. An assessment exemption application could be partial. It doesn't need to be 100%. We'll get into a couple of cases where it was a partial exemption. So you could have a hospital or an office, a facility maybe at 60% or 70%, not necessarily 100% as far as exemptions go. So I'll scroll through the parts of 1016, and the key part for medical facilities is paragraph H. As you can see, this section does not exempt property tax of an office or a practice that is owned by a hospital that is not substantially related to support or supportive of the inpatient facility of the hospital, unless the office, practice, or other property provides support for charity care, including those individuals who are indigent, and then also provides community benefits. A key phrase in this part, the citation, is the last sentence in H-2, which is participation in the Medicaid or Medicare program alone does not entitle an office, practice, or other property to an exemption under this section. So the taxpayer applies, do they meet that criteria under section H? Much like what we see with other types of properties, if they own land and they're going to construct on it later, there are certain requirements as far as exemptions go. Also, if the property is conveyed to another, is there a carryover? And also, you can see, in terms of the back taxes and recording of the property. We also, much like all the other exemption issues, there's liability. The next code citation is that a taxpayer or medical facility may claim an exemption is under Indiana Code 6-1.1-10-18.5. And if you read this language, it's identical to what we saw just a minute ago in 6-1.1-10-16 paragraph H. And again, emphasize just because a medical facility or provider claims that they're in the Medicaid or Medicare program, that alone does not entitle the office or practice or other property to an exemption under this section. It's not automatic. They must meet the criteria. Tangible property is exempt, as you can see, is if it's owned by an Indiana not-for-profit corporation and used by that corporation in the operation of a hospital under Indiana Code 16-21, or a healthcare facility license under 16-28, or the operation of a residential facility for the aged under 16-28. And as you can see, property shall be assessed to the extent required under the code citation 6-1.1-11.9. And 6-1.1-11.9 basically just says that property shall be assessed unless it's owned by the government of the United States or a subsidiary or political subdivision of the state. There are two other exemptions for hospitals. The first is if you have a hospital bonding authority under Indiana Code 5-1-4-26, and that states, as you can see, authorities are not required to pay any taxes or assessment upon or in respect of a project or any property acquired or used by an authority. And then the second one is Indiana Code 16-22-6-34. that deals with county hospital building authorities. And in that case, property owned by the authority is exempt from taxation. So there are several counties throughout the state where you have a county hospital, and that county hospital probably would fall under the exemption from that second bullet point, the 16-22-6-34, since it is a publicly owned hospital. There are several Indiana Board of Tax Review and Indiana Tax Court decisions that we'll talk about. And one of the things that I'll keep repeating is that each case stands on its own. So while these can be used to help identify or see, hey, does this exemption fall under this category? Maybe a taxpayer is claiming that in this case, I used this or that case, but each case does stand alone, and that's how they should be viewed. So the first case that we're going to look at is SC Indiana Medical Holdings, Inc. versus the Bartholomew County Assessor, and this dates back to 2011. And this case deals with assessment practices. As you can see, the property was a medical office building. The petitioner, taxpayer, was assessed for almost $1.6 million in 2011. And one of their contentions was that on the front of the property record card, the improvement value was different than the back of the property record card, which showed the replacement cost new at an amount significantly lower than what was on the front. And the depreciation you can see is 12%. And so the petitioner said, indicating, subtracting this, that there was a difference in terms of what the amount should be. They also, you can see the petitioner testified that they were wanted to compare their 2011 value with the subject of the subject property with the comparable properties. The respondent, in this case, the assessor, notified or indicated that the comparison of the front and the back values on the property record card. The difference, as you can see, the second bullet point was because of the correlation of value. So in other words, that there's they're trying to equalize or bring the value up to what it should be, and just because it's different on the back does not necessarily mean it's wrong for what's on the front. Also, in some situations, the cost approach, as you can see, is the most appropriate, but there also may be other times when the sales approach or the income approach might be used. So as an assessing official and you're looking at assessing property and you're trying to get to the approximate market value and use, you may be using the cost approach, you may be using the income approach, or you may be using the sales approach. Capitalization rate was what I was trying to think of earlier when I drew a mind blank. When you're doing the income approach and looking at the capitalization rates, you want to make sure that you are using, and certainly there are some services that provide specific capitalization rates for medical facilities. You can also, if there are appraisals, perhaps the capitalization rate from the appraisal can be used. In this case, the assessor had used an income producing service to help determine the value. The assessor, the respondent, also cited that there were 4 medical office sales in the sales comparison approach, including the first one, which was the subject property itself. And the subject property itself sold in 2007, 4 years prior to the assessment date, for $2.1 million, which is significantly lower than what the assessed value was. And even time adjusting that value, you can see it's still significantly lower than what the assessed value is. By comparing the 4 medical offices, the assessor was looking at, what is the per square foot range for the properties. And again, it showed that reconciling the values using the cost approach and then also the income approach was still lower than the sales approach amount when it was time adjusted. In this case, the assessor was asking for a higher assessed value based on all the things that, going through and doing the income approach and the sales approach. Petitioner just basically said that the assessment is incorrect, and you can see the IBTR held that the petitioner, the taxpayer, failed to make a prima facie case for reducing the assessment. They also indicated or stated that the respondent, the assessor, failed to make a prima case for increasing the assessment. Hence, there was no change in that assessed value. The next case we're going to look at is G&E Healthcare REIT, REIT, versus the Marion County Assessor. And these properties are multi-tenant general office, medical office buildings located on the west side of Indianapolis. And the petitioner argued that they were overassessed. And in doing so, the petitioner presented 4 appraisals by a certified appraiser. The appraiser prepared the appraisals in conformance with USPAP with the March 1st, 2011 assessment date. However, the appraiser did not complete these until 2018, so 7 years later. The appraiser obviously did not inspect the properties on or around the 2011 effective date. And because of that, he made extraordinary assumptions based on information provided by the ownership about the condition of the property, that the property was in average condition. The appraiser acknowledged that there were changes or renovations made between 2008 and 2012, and that the properties may have been in fair condition in 2008. And he stated that if there had been significant changes, the condition of the properties, there would have been corresponding change in the amount of rent collected. So if the taxpayer, the owner, made significant changes, they would increase the rent collected to make up for those renovations. The properties were transferred in July of 2008, and it was part of a portfolio sale, and various values were allocated to each property. But as you can see, how do you allocate the amounts? And it was indicated, the appraiser indicated that it was likely based on other factors other than market value. So if you have a taxpayer that has a portfolio sale where you have 4 sales, for example, that doesn't necessarily mean that each property is going to be allocated 25%. Maybe one of the properties is larger, and maybe it should be 40% of the allocation, or 45 or 50%, whatever the case may be. However, ultimately, the amounts were not a true representation of the market value and the use for the properties. In this case, the appraiser used a sales approach and an income approach, but they did not consider or use the cost approach, stating that basically the age of the property would have made depreciation very, very subjective. Sales in the sales comparison approach, the appraisers selected comparable properties within a 5-mile radius. But if you recall, back in 2008, this is when we were in the midst of the Great Recession, and so the appraiser didn't necessarily take everything into account, and they concluded that the sales reflected the economic times of 2011. So one of the things the assessor did was they marked the sales from this property as invalid for trending because they had been on the market for well over 1,000 days. As I indicated before, one of the things that you have to look at is each case stands on its own, and the tax court, you've probably heard, has frequently stated that if a appraisal is done in conformance with USPAP, it's a preferred way, or typically a way, to establish a prima facie case. But in this case, the assessor, the respondent, stated that the appraisals were flawed for a few different reasons, including that they failed to consider the 2008 portfolio, the sales, and the properties. A key thing we talked about to start with was the classification and what schedule of the properties do you use as far as a GCM or GCR. And in this case, one of the contentions was that the appraiser incorrectly classified the property as general office buildings rather than medical office buildings. And one of the reasons for that is that with medical office buildings, you may see or find additional features, say like additional plumbing features in a medical office building. So if you think of general office compared to a medical office, what additional things would you find in a medical office compared to a general office? And also, as far as a retrospective appraisal, obviously the appraiser can't turn the clock back and see what exactly it looked like, in this case 7 years prior. The respondent, the assessor, submitted 3 appraisals as of with the lease fee interest as of May of 2008. Again, the respondents' appraisals were several years after the facts, and so the board, the IBTR, found that the appraisals lacked probative value or evidence because of the time difference. So you can see how the board ruled, what they stated in terms of, you know, the sale at issue and the portfolio sale. So ultimately, the IBTR ruled that the respondent's evidence appears to reflect the investment value of the property and not the market value and use of the property. Then, so for the 2011 assessment date, they found, while that the appraisal wasn't perfect by the petitioner, it was most closely relevant to the value of the property. We're going to switch gears a little bit now with our IBTR decisions. Now we're going to look at more of the exemption side of things. And in this case, it's the St. Joseph Regional Medical Center. They had sought an exemption for portions of what they call medical pavilions that they rented to physicians and other medical providers. And the PDBOA, in this case, did a partial exemption. They showed that the parcels should be 63% exempt and 37% taxable. In this case, St. Joseph is a not-for-profit corporation. They operate a hospital, and they have these 3 medical pavilions. The hospital operates these 3 medical pavilions. St. Joseph, the hospital corporation, did not receive any of the tenants' income, and they just charged what they thought was market rent. The tenant doctors at these pavilions were apparently available for the hospital's residents, and they quote unquote did some teaching in conjunction with being tenants, and they were also quote unquote supportive of the emergency room staff if they were needed. It didn't quantify how much time they did teaching. It didn't quantify how much time they were spent or needed in the emergency room. It did not state how much time they were available for the hospital residents. It just stated that they were available. The reason St. Joseph claimed that the portions of these facilities, these pavilions, should be that it rented to doctors should be exempt is because they supported the hospital's exempt activities. And generally, non-profit hospitals that are maintained to quote unquote relieve the destitute and deserving are charitable. However, other property, owned by a hospital, not-for-profit hospital, does not automatically receive a charitable purpose exemption. So in this case, just because St. Joseph had 3 pavilions does not mean that those other properties were automatically to receive a charitable exemption. As far as the Indiana Code 6-1.1-10-16H that we looked at earlier, an inpatient facility is not the entire hospital, but only that part where admitted patients are treated. To be substantially related to a property or supportive of, basically the facility must, as you can see, provide considerable aid to or promote to a considerable degree the interests of a hospital's inpatient facility. In this case, the St. Joseph, the board ruled that the St. Joseph offered little evidence to show how its tenants use the subject properties or parcels to support the inpatient facility. Even though they claimed they did teaching, they were available for emergency room and and to tend to the patients. They did not show enough or any evidence to show how the tenants use the subject parcels. Also, the fact that these facilities, these pavilions were operating at a loss doesn't bolster the relationship between the offices and the inpatient part of the hospital. So in this case, the board ruled that the St. Joseph failed to make a prima facie case, and that it was not exempt. The next case is also looking at a percentage. In this case, it's up in Lake County, the Methodist Hospitals Inc. Versus Lake County, Peterborough. And Methodist Hospital in Lake County appealed to the IDTR stating that they should be partially tax exempt. They didn't claim that they were 100% exempt, but they claimed that they should be partially tax exempt. And in this situation, Methodist hospitals house a combination of hospital programs and private physicians. The Lake County Peterborough had determined that the land and improvements this goes back 22 years, but in 2000 it was 100% taxable. And the petitioner claimed that they should be 60% tax exempt. So I mentioned earlier that there could be a percentage, 60%, 70%. So in this case, the petitioner said they should be 60% exempt. One key thing here in this part that I bolded or highlighted is that, as you can see, the grant of federal or state income tax exemption does not entitle a taxpayer to property tax exemption, because income tax exemption looks at how much how is the money spent versus how is the property used. So even though a taxpayer may claim that they're a 501c3 entity, that's for income tax exemption, and we'll talk in a little bit about property tax exemption. So just because someone says we're income tax exempt does not automatically make them property tax exempt, because as you can see, income tax exemption is based on how money is spent. In this case, the petitioner stated they have programs that they were provided that were related to the hospital. However, the petitioner did not provide any evidence or any documentation to show how this was done, and how does it further exempt the purpose of the hospital. So we talked about income tax being on how the money is spent. With property tax exemption, it's basically how the property is used. And one of those is the predominant use test. And so even though there may be charitable giving, may be used for charitable purposes, what is the predominant use of the facility? Well, predominant use is 50% or more of the time that it's used or occupied in the year that is prior to the assessment date. So if the assessment date is January 1st, 2022, how is that property being used during calendar year 2021? The next case is another situation where a hospital's appealing the local Peterborough determination, in this case in Allen County, and the Parkview's charitable exemption applications were denied. The petitioner, we saw that the first one, that first code citation, Indiana Code 6-1.1-10-16, that they contend that they were exempt for charitable purposes. However, the assessor contended that the petitioner's charitable acts were de minimis, or very minor, or very minuscule, and hence it did not qualify for the exemption. In this case, the property being appealed is the real property as well as personal property of office furniture and equipment and medical equipment. The PDVOA denied that exemption, and they determined that it was 100% taxable. And as I mentioned, a lot of times taxpayers will claim that we're a 501c3 and therefore we're exempt from federal income tax, and we should be exempt from property tax as well. Well, they'd have to prove that, much like if it's a church or other not-for-profit entity, they would have to prove, here's why we should be exempt from property taxes. Parkview Memorial required that its doctors assist with the charitable purposes by providing care to the indigent and also being involved in community benefit-oriented programs. And approximately 8 to 10% of the total physicians worked for them. The crux of this issue is that the taxpayer, Parkview Memorial, stated that the dollar amount that was being spent or charged was small in relation to their total revenue, but they stated that there was nothing statutorily indicating that the percentage of indigent care must be met at 5%, 10%, 20%, 100%, whatever the case may be. So they said, as long as we're providing care to the indigent, we qualify. The assessor responding, basically, as I mentioned previously, indicated that it's a de minimis amount, that there was a minimum amount of care given, and they should not receive the exemption. So in order for the taxpayer petitioner to be exempt, there are 3 tests or standards that must be met. The first is the predominant use test that we talked about, which is 50% or more. The substantial relation test is set forth by that 6-1.1-10-16 paragraph H. And then also the charity care or community benefit obligation is set forth in the code. And in this case, the substantial relation and the charity care or community benefit test were directly applicable to the subject property. The petitioner, the IBTR, found that the petitioner presented no evidence whatsoever indicating that the predominant use of the property is being used for indigent care or community benefits, and that the physician's offices were not exempting the purpose of the hospital, and it wasn't, and the amount of charitable care and community service was insufficient to justify the tax exemption. And so the board ruled that the property was indeed 100% taxable. The last case we're going to look at is from 2019, and this is an Indiana tax court decision. And this is a key case for Indiana law and assessing officials, and if you have the opportunity, you should look at it. Basically, what the tax court stated or held is that the corporation, which was a holding company for the property, did not prove that it should receive an exemption, either as a charitable or a religious exemption. So this goes back to 2014 and 2015, and the building corporation owned several parcels or properties, and the Warwick County, this down in southern Indiana, the Warwick County Property Tax Assessment Board of Appeals found that the property was 100% taxable for both years. St. Mary's Building Corporation appealed to the IBTR and then subsequently to the tax court. Building Corporation was an Indiana not-for-profit corporation, and they held deeds to parcels which included a medical building known as the Epworth Crossing Building. The building corporation sought a charitable and religious exemption, basically on the grounds that it was the same as what was happening in the Epworth Crossing building was on the same grounds as the hospital and medical group and the breast center. And they did not seek 100% exemption, but they sought 82% of the property for an exemption. Here, the building corporation stated or said, you know, we're doing everything as part of being the hospital, and we're a 501c3, and that we should be exempt. As we've stated, I've stated, exemptions are highly fact case sensitive, and basically you have to look at each case on its own facts, its own merits, and you know, just because there may be a trend in one case or one situation does not mean it should be ruled in another case, and you know, just because of its character or the deeds of it. So just because a hospital may meet the criteria for being exempt doesn't mean an auxiliary building that's part of the hospital or owned by the hospital building corporation does not automatically mean that it should be exempt as well. The tax court ruled that the predominant use test is what should be used in regard to exemptions and granting exemptions, and that it has to be substantially related to the exercise or performance of one of the stated purposes, be it religious or charitable. And as we talked about, it's based on what was the property being used for the year prior to the assessment date. So we've stated predominant is more than 50% of the time, and be it a medical office, medical facility, or a not-for-profit or a church, that exemption case stands on its own facts, and ultimately, how does the party or the taxpayer present those facts? You can see what the court ruled in terms of the charitable purposes exemption, that it automatically does not automatically apply to other properties owned by the holding, in this case, the building corporation. One of the things that the taxpayer did not do is that the taxpayer did not provide a time usage study for that portion of that Epworth Crossing building. And a time usage study would be looking at how much time the property is being used for exempt purposes. You know, is it 50% of the time, 60% of the time, 70% of the time, whatever the case may be. However, in this case, the building corporation did not provide anything to substantiate how much of the time was used or should be exempt, and because of that, the exemption was denied. So that wraps up the, as you can see, you know, that they did not meet the religious exemption. So that wraps up the review of the tax court decisions and IBTR decisions. And so Jenny, open it up for questions. If anybody has any questions, do we have any, Jenny?
We don't have any questions right now, but if anybody does, we can leave it open for a few minutes and you can enter those into the chat box. And if you also have questions later on, you are also welcome to contact Barry. He has his email address and phone number. You can also contact me. So whatever is easier for you, but we do welcome and appreciate questions. We'll leave this up for a few minutes. I will do a couple of final housekeeping items. Like I said at the beginning, we will be sending out the email tomorrow with the presentation, the video, the survey, and the CE form. This is valid for 1 hour of CE, and you will need to self-report that you attended. and then submit that either to Donna in our office or to your governing body for that CE credit. The other thing is the survey. We do appreciate the feedback that you all provide to us. We are starting to plan for our 2023 webinars, and so please share any topics that you would like to see. That's where the medical facilities topic came up. We had a number of people that had requested that, so do appreciate Barry putting this together. For the remainder of this year, we do have 2 more webinars. One in November is going to be presented by our data analysis team. And then our second email in December, our webinar in December, is going to be on our assessment team is also going to be giving that presentation. So please feel free to.
On disasters is the topic for
on disasters, yes. Disaster assessments. So thank you, Barry.
Yep.
So you can join us for either or both of those and get registered if you haven't already. But we are planning for the 2023 webinars, so please feel free to share those topics that you would like to find out more information on. So I don't have any other questions. So if you do have any questions later on, please feel free to contact Barry or I, and we'll get those answered for you. But we do appreciate you joining us today, and let us know what you would like to see for next year. Thank you all so much.
Thank you, everybody.